Welcome to another video by ChalazionTreatment.com. In today's video, we're going to be discussing the topic of Chalazion treatment options. Now, when it comes to Chalazion treatment, there are several different approaches. Both Western and alternative medicine have developed cures for Chalazion cysts, which are basically caused by the enlargement or inflammation of the meibomian gland located in the upper or lower eyelid. Now, the development of a chalazion takes place over the course of several weeks, with the nodule developing into a small, round, painless lump about 1/8 of an inch in diameter. These are also known as meibomian cysts, tarsal cysts, or conjunctival granuloma. And the inflammation that it results is caused when the ducts of the meibomian gland that lubricates the eye get clogged, and because passage is impossible, that oil builds up inside the gland and causes inflammation. Now, because this is not a bacterial infection, the lump simply hardens over time and causes pain only when it has grown large enough to affect the endings of the sensory nerve. Now, in worst case scenarios, the chalazion can impinge on the cornea and even cause vision problems. Chalazion treatment depends on the type of approach taken to address it. What we're about to get into will be a discussion of the various treatment options and remedies used in home care, conventional medicine, and also alternative medicine. Now, I need to remind everyone that the following information should not be taken as medical advice and is not meant to be used as a substitute for the expert diagnosis and opinion of a medical professional. Now, the first option that we're going to discuss today is home treatment. In the initial stages, the Chalazion treatment that most physicians recommend is putting a warm compress on the affected eyelid several times a day. A clean, warm, wet towel is placed over the chalazion for an average of 8 minutes, 3 to 4 times a day to facilitate drainage of the oil and thus reduces the swelling. It is also recommended that the area around the chalazion be lightly massaged several times during the day as well. Now, an important thing to remember when doing a chalazion home treatment is not to pop the chalazion like you would a pimple, nor should you ever scratch it. Doing either of these can cause further complications. Another chalazion remedy is the use of warmed guava leaves on a damp cloth to reduce inflammation and swelling. Acacia leaves may also be boiled, decocted, and used as a compress on the eyelids. This is said by some to aid in chalazion removal. In some cases, a chalazion gets reabsorbed into the body a few months after its initial appearance, even without any form of home care, medical or alternative medical treatment. Now, the second Chalazion treatment option that we will be discussing is that of conventional medicine. Now, in Western or conventional medicine, an eye doctor will examine the eye thoroughly to determine the course of treatment that needs to be followed. If an infection is suspected to be present, usually antibiotic drops may be prescribed. Corticosteroids may also be injected into the lump, which is not pleasant, obviously, and this is done in an attempt to reduce the swelling. This is the approach taken when the chalazion is smaller in size. When the chalazion does not resolve with these approaches and does not resolve after a matter of several weeks, surgical intervention is usually the recommended method of treatment. Chalazion removal surgery is also the approach usually recommended by an ophthalmologist when the chalazion has grown large enough to actually obstruct vision and cause other further problems. The surgical procedure, which is done to remove the chalazion, is usually performed under local anesthetic. A pressure eye patch is applied for about 24 hours after the surgical procedure to manage bleeding and swelling, and once the patch is removed, warm compresses are also applied to further bring down the swelling. Antimicrobial eye drops are usually prescribed to prevent secondary infections, and painkiller medication is typically given at that point to allow the patient to cope with minor discomforts after the operation. Now, one advantage of surgery is that it shows immediate results. While complications like bleeding and recurrence of the nodule may occur, they are rare and very seldom happen. In cases where chalazion becomes recurrent, one possibility that conventional doctors always look at is an oil gland abnormality. Acne rosacea, for example, is one such condition requiring long-term oral treatment. Cleaning the lid also prevents the development of chalazion. In our special report available on our website, we actually go into additional treatment options that are meant to prevent the ongoing development of chalazion. The third thing that we're going to discuss today in this video is homeopathy. Chalazion homeopathy treatment is another valid option. It's an alternative form of medicine that dissolves the chalazion without any surgical intervention. Following the principle of the law of similars, Chalazion homeopathy involves the introduction of substances into the body that reduces the symptoms and allows the body's system to actually heal itself naturally. It makes use of homeopathic remedies that have been successed or diluted until no active ingredients remain. Now, the idea behind homeopathy is similar to vaccination, although homeopathic practitioners claim that homeopathy is above and beyond it, inasmuch as the doses given are so minute yet remain powerfully effective. Chalazion homeopathy is actually preferred by those who do not want to subject themselves to surgical operations so close to the eye. Homeopathic physicians claim that there are no side effects with homeopathy and that it gives 100% treatment for chalazion. Homeopathy does not only treat the condition itself, but also the individual's tendency for sty formation. Now, unlike conventional medicine that necessitates a face-to-face consultation with a doctor to make a diagnosis and to prescribe medication and, of course, a treatment, there are some homeopathic doctors who give online chalazion treatment options. Patients are asked to fill in and send an online consultation form, which the homeopathic doctor evaluates before prescribing any of the 42 medications for chalazion. A downside to the homeopathic approach is that it takes a long time, typically between 2 and 5 months before results show up. Moreover, the exact homeopathic remedy must be given before treatment produces the desired results. The lengthy time between chalazion treatment method and results makes it inconvenient for those who seek quick results. Now, these are the most common approaches to chalazion treatment. Once again, please remember that what was discussed in this video above is not intended to be used as a substitute for medical treatment. When you see chalazions or styes that arise, it is recommended that you always consult an eye doctor professional, whether from conventional or alternative medicine, for a chalazion treatment that is right for you. We hope that you've enjoyed this video. Please visit our website at ChalazionTreatment.com, where we offer a special home report, which is instantly downloadable in PDF format, that offers a step-by-step solution for chalazion cysts that is painless, all-natural, non-surgical, affordable, and effective.